So,
all right, question 23. I'm taking my CPC exam in April. Do you know if I can use my CPC? No, no, no.
no.
Do not use
Don't.
old manuals. Can you? Yes. Should you? No. You're
No.
paying $300. Why do you want to risk having to go take it again? Because, and many people are missing the exam by 2 points. So if you're using old manuals, the chances of that being you are very great. So you're better off investing in a new manual than having to pay to take the exam again. Now, that being said, for this year, you can get away with a 2013 ICD-9 because the codes are basically frozen. There's no new codes for this year. And I don't know if they could do that for 2012 as well. Did we have that many changes for 2013 ICD-9? I don't think that many, but
Yeah.
definitely CPT, you need to have current year.
Yeah.
So. Okay, are there any remote jobs for apprentice coders? They're very hard to find. That's why we're excited about Practicode. And with Practicode, they don't care if you have the A after your credential. What they care about is your proficiency. So when you log into Practicode and you start coding those practice cases, your score is going to be horrible at first. And over time with practice, especially when you stay in one area of focus like radiology or family practice or cardiology, you will become proficient at that particular specialty, and then you go and you apply for a job with a VIA code and say, hey, by the way, I'm a Practicode user and this is my proficiency score. They will pay more attention to that than the fact that you don't have experience and that you're an apprentice. Okay, because really that's what matters, is how well you can code, not the fact that you might have 10 years experience, because maybe you're just a horrible coder and you've been doing it for 10 years badly, So that's what we're currently recommending, and that kind of answers question 21 too. How can you get experience? It's just like any field that you get into, you got to get that first job, and it's always the hardest because most employers want people with experience. You would too if you were the employer. It doesn't mean that there aren't jobs out there that don't take a chance on a new person. And that ebook that we have that talks about getting that first job, we highly recommend that. It's free. We had our writer go out and interview people that were looking for coders in different areas, billing companies, doctors' offices, hospitals, and basically we went down the chain of what is it about a cover letter that will get your attention to read someone's resume? What was it about their resume that would get you to call them in for an interview? What is it about an interview that would have you hire them even if they didn't have experience? So there's lots of nuggets in there. My biggest takeaway from it is make sure your cover letter matches the job. Don't have it be a canned cover letter. If you say, I'm really excited to, about the possibility with the position of with ABC, clinic, I've heard great things about you. My doctor, my father went there. It's just something that you could tie it into, that you actually really are tying this cover letter in with the specific job offer. Not offer, what am I trying to say? Job, want ad.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.